Welcome, and thank you for turning to the experts at Home Helpers for help in caring for your loved one with Parkinson's disease. The first step in facing any problem or challenge is to understand it. In this presentation, we will explain what Parkinson's disease is, its symptoms and effects on the body, keys to caring for someone with Parkinson's disease, and we will offer some helpful tips that will make life easier for you and your loved one. Parkinson's disease, also known as PD, is a chronic and progressive movement disorder. That means that symptoms continue and worsen over time. While there are treatments for Parkinson's disease, there is no known cure. Parkinson's involves the malfunction and death of vital nerve cells in the brain called neurons. Parkinson's primarily affects neurons in deep parts of the brain that control movement. Some of these dying neurons produce dopamine, a chemical that sends messages to the part of the brain that controls movement and coordination. As the disease progresses, the amount of dopamine produced in the brain decreases, leaving a person unable to control movement normally. Let's take a look at who is affected by Parkinson's disease. Nearly 1 million people in the United States are living with Parkinson's disease. Approximately 50,000 Americans are diagnosed with Parkinson's disease each year. However, this number does not reflect the thousands of cases that go undetected. Experts say that determining an actual count may be impossible, as many people in the early stages of the disease assume their symptoms are the result of normal aging and do not seek help from a physician. Diagnosis is sometimes difficult and uncertain because other conditions may produce symptoms of PD, and there is no definitive test for the disease. Men are 1.5 times more likely to have Parkinson's than women, although the reason for this is unclear. The incidence of Parkinson's increases with age, but an estimated 4% of people with PD are diagnosed before the age of 50. Despite decades of intensive study, the causes of Parkinson's remain unknown. Some experts think the disease may be caused by a combination of genetic and environmental factors. The vast majority of Parkinson's cases are not directly inherited. About 15 to 20% of people with Parkinson's report having a relative with the disease. In large population studies, researchers have found that people with an affected first-degree relative, such as a parent or sibling, have a 4 to 9% higher chance of developing PD as compared to the general population. So, if a person's parent has PD, his or her chances of developing the disease are slightly higher than the risk among the general population. Some scientists have suggested that Parkinson's disease may result from exposure to an environmental toxin, although it is important to note that a simple exposure to an environmental toxin is never enough to cause Parkinson's. Research suggests that rural living, well water, manganese, and pesticides all might contribute to Parkinson's risk. Traumatic brain injury also can lead to the development of the disease. And new research indicates a possible link between intestinal bacteria and Parkinson's. The most common symptoms of Parkinson's disease can be classified into 2 primary categories: those that affect the body's motor skills and those that do not. Primary motor symptoms associated with Parkinson's disease include tremor, typically in the hand or foot, on one side of the body, or less commonly in the jaw or face. These tremors occur when the body part is at rest and typically cease when the hand, foot, or face is performing an action. Bradykinesia, which means slow movement, causes difficulty with repetitive movements such as finger tapping. Due to bradykinesia, a person with Parkinson's may have difficulty performing everyday functions such as buttoning a shirt, cutting food, or brushing his or her teeth. Bradykinesia also appears in short, shuffling steps. Rigidity of the limbs, neck, and trunk. A person with rigidity and bradykinesia tends to not swing his or her arms when walking. Rigidity can be uncomfortable and even painful. Postural instability is a tendency to be unstable when standing upright. A person with postural instability has lost some of the reflexes needed for maintaining an upright posture, and may topple backward if jostled even slightly. In addition to these primary motor functions, Parkinson's disease may also appear in secondary motor functions, causing symptoms that include freezing, which is stopping while walking or performing other tasks, stooped posture, characterized by a tendency to lean forward, speech problems, such as softness of voice or slurred speech, and difficulty swallowing or chewing, also due to muscles working less efficiently. In addition to motor symptoms, most people with Parkinson's experience non-motor symptoms, those that do not involve movement, coordination, physical tasks, or mobility. Many researchers believe that non-motor symptoms may appear years before the more outwardly noticeable symptoms of the disease. Those early symptoms include loss of sense of smell, sleep disorder, including insomnia, nightmares, and daytime drowsiness, and mood disorders. Emotional changes such as fear and anxiety, loss of motivation, irritability, and unusual negativity are among those that could indicate a mood disorder caused by early Parkinson's disease. As someone who is caring for a person with Parkinson's disease, keep in mind that PD is unpredictable, it is complicated, and it is progressive. Understanding these truths is key to your caregiving. A Parkinson's patient's symptoms can vary in number and severity even throughout a single day. To determine what might be normal and to keep track of changes that have taken place, keep a journal of symptoms, along with notes about activities and medications. Changes are to be expected, but you should tell the doctor about any abrupt changes in your loved one's ability to move. Be sure also to note any new symptoms. As symptoms change and the disease progresses, it's important to adapt accordingly. Grab bars and railings can be installed to help your loved one get around safely. Your loved one's doctor can help you determine when it's time to introduce a walker or a cane. Modified eating utensils with larger handles can help a person with Parkinson's disease continue to feed himself. And when buttoning a shirt or tying a shoe becomes difficult, consider options such as Velcro. Freezing is one of the effects that Parkinson's disease may have on secondary motor skills. Some describe freezing as feeling like their feet are stuck to the floor. In addition to suddenly stopping while walking, Parkinson's patients may stop abruptly while speaking or performing repetitive movements such as brushing their teeth. While experts do not know what causes freezing, it often happens when something interrupts or gets in the way of a sequence of movements. Here are a few techniques that could help to get things started again when freezing occurs. The management method is a 4-step tool that allows the person time to regroup and start over. The 4 steps are stop, take time for the person to calm himself, think, what do you want to do, plan, how are you going to do it, and finally, do, complete the task or movement. When freezing takes place, remind the person to not try and move forward right away. Instead, use the weight shift method. Have them gently move most of their weight to one leg before stepping forward. They may be able to start walking again by gently rocking their head and shoulders from side to side. This rocking can help them shift body weight to the supporting leg. Use counting, sound, or a rhythm to get the person started again. Try 1, 2, 3, step, or ready, steady, go. Encourage the person to count his steps or to count them off, saying 1, 2, 1, 2, or left, right, left, right. Music can help some people establish a rhythm that facilitates walking. Try using an MP3 player, but be sure the music isn't too fast. People with Parkinson's disease often experience difficulty swallowing. This makes eating difficult and even dangerous. But keep in mind that a nutritious diet is important to your loved one's overall health. Here are some simple ways that you can help. Encourage your loved one to sit upright and tilt their head forward while eating. Cut food into small bites and encourage small sips of liquid. If the person tires while eating, opt for smaller meals served several times throughout the day. Be sure food is cooked to a smooth texture and that meats are tender. You may want to try using a food processor to obtain the proper texture for some foods. Tremors are among the earliest and most common symptoms of Parkinson's disease. They also can be troubling to the patient as well as those around them because of the inherent lack of control. But there are things you can do to help. It may help to hold the affected limb in certain positions. Try several to find the one that offers relief. Have the person hold on to something for stability. This can often lessen the severity of a tremor. Hold the upper arm against the body. This also can calm a tremor. Keep track of when tremors tend to occur. If tremors occur or worsen at the end or beginning of a dosing period, this may indicate the person is experiencing wear-off. If this occurs, consult the person's physician. A change in medication may be needed. We mentioned before the importance of proper nutrition in living with Parkinson's disease. Here are a few things to keep in mind. Encourage your loved one to eat a nutritionally balanced diet that contains plenty of fruits, vegetables, and whole grains. A balanced diet also provides nutrients such as omega-3 fatty acids that may be beneficial for people with PD. Be careful about how much sugar your loved one eats. A diet with lots of sugar can have too many calories and too few nutrients. Cut back on salt and salty foods to reduce the risk of high blood pressure. Blood pressure fluctuations are not uncommon with Parkinson's disease. People with PD often lose weight without meaning to, due to nausea, loss of appetite, depression, and slowed movement. You can combat this unplanned weight loss with proper nutrition. And remember, it's just as important for the caregiver to follow these healthy habits. Doctors have long suggested that exercise is important in the treatment and management of Parkinson's disease. The Michael J. Fox Foundation suggests that exercise is second only to medication in the management of the disease. Regular exercise can strengthen muscles, increase mobility, improve flexibility, and improve balance, which can mean fewer falls. Exercise also can ease depression and anxiety. Choose a form of exercise that is challenging yet safe for the person with Parkinson's disease. Water aerobics and swimming are good options to try because they can be practiced without risk of falling. Yoga also has benefits for the body as well as the mind and can help improve balance. Walking is an easy way to get moving because it can be done anywhere. Exercise doesn't have to involve a gym. Some find dancing to be a fun way to keep in shape. You may consider hiring a personal trainer who can customize a workout regimen to meet your loved one's individual and changing needs. Parkinson's disease comes with its own unique set of challenges for the patient as well as the caregiver. Because the incidence and severity of PD symptoms vary from day to day and even throughout the day, a person's caregiving needs are always changing. It takes skill and patience to know when to assist with a task and when to simply allow the person more time to do the task independently. This is something you will learn over time. It also takes time and ongoing education to learn the multiple symptoms of PD and the changing needs of a person with the disease. A list of resources to help you stay informed is provided at the end of this presentation. Parkinson's disease affects the patient physically as well as mentally and cognitively. In addition to your loved one's changing physical condition, he may also experience depression, anxiety, and even dementia as the disease progresses. Understanding your loved one's needs requires good communication. but that can become increasingly difficult as the disease progresses. As speech becomes difficult, your loved one might relay messages with a look, a shrug, or body language. Pay attention to all these means of communication. If you don't understand what your loved one says, ask them to repeat it. Encourage your loved one to speak slowly. Repeat what you hear to be certain you understand what has been said. Allow the person with Parkinson's disease plenty of time to respond and resist the urge to finish their sentence for them. Most of all, be patient. The struggle to communicate can be frustrating and tiring for someone with Parkinson's disease, as well as for the person with whom they are trying to communicate. As you and your loved one journey through life with Parkinson's disease, here are a few basic caregiving tips to keep in mind. Learn when to help and when not to. Foster confidence and independence by encouraging your loved one to do what he can for himself, keeping in mind that that could change at any time. Allow extra time for your loved one to do things on their own. Watch for signs of depression. According to the Parkinson's Disease Foundation, up to 60% of Parkinson's patients experience mild or moderate depressive symptoms. It can be difficult to diagnose, as some of the symptoms of depression, such as low energy, insomnia, excessive sleep, and weight loss, are similar to those of PD. Encourage exercise for all of the reasons previously discussed. Caregiving is hard enough without being overstressed, depressed, or physically unhealthy. Be sure to take the time to take care of yourself by eating right, exercising, and getting a good night's sleep. Be patient with yourself. This job isn't easy, and no one expects you to be perfect. Ask for help and accept help when offered. Find a local support group. One place to turn is the Midwest chapter of the American Parkinson's Disease Association at www.apdamidwest.org. Learn more about Parkinson's disease by visiting these and other organizations. Many of these organizations also offer support groups for those with the disease and their caregivers. Caregiving is a big, often exhausting job, and you don't have to do it alone. Home Helpers is here to lend a hand, whether it's to answer a caregiving question, provide an hour or two of respite, or around-the-clock care. Consider letting our trained, compassionate caregivers make your life easier.